Welcome to The Power of One. Today, I have the pleasure of speaking with Dr. Goldstein from St. Chris, and we are going to speak about autism. We're going to learn a little bit about it and how we can better care for our children. Welcome to the show, Dr. Goldstein.
Thank you. I love seeing you again.
Dr. Goldstein, let's talk about autism and how it's diagnosed.
Yeah, this is, it's a simple question, but a pretty complicated answer. As best as we understand autism, we call it a neurodevelopmental disorder. It seems to have genetic components, it has biologic components, it has environmental factors that all may contribute to its development. But what it involves primarily is difficulties with social interaction and communication, and sometimes accompanied by, but not always, by a tendency to certain kinds of repetitive behaviors. But it is a very, very wide-spanning condition. And in some ways, I kind of liken it to telling someone they have a cough. Well, a cough can be caused by so many different things. It doesn't tell us exactly what the cause is. It simply describes what you're seeing. And the diagnosis of autism doesn't tell us why they have that condition. It just describes the characteristics that they are presenting with. And I think, many, many years from now, they're going to have a much better understanding of what the different neurobiological pathways are that lead us to the same symptoms. But there are probably a lot of different things that give you a similar set of symptoms or behaviors, and which means that the prognosis is very different from person to person. Autism is by no way or means a homogeneous, uniform diagnosis with a single approach to managing it and with a single outcome expected from it. So I would say the most important things to remember about it is that it's a spectrum. There are some kids that are very mild in their impairment, and there are other kids that are very, very severe. And we would now use the term neurotypical versus neuroatypical. They're probably what we would consider to be neuroatypical. But it has its own extraordinary strengths. And you may know some of the people who have been diagnosed with autism have been extraordinary contributors to society. The one that I know the most about is Temple Grandin, who was diagnosed with autism at a young age, but she's become a pioneer in humane treatment of animals, precisely because she has a stronger connection in many, many ways with animals than she does with humans. And so it doesn't make it worse or bad or when it's in that milder form than any other type of personality that people have. And it's associated with its own strengths. It's a tendency to details, a passion about maybe a particular subject or activity that they become experts in. So that's sort of the mild end of the spectrum. And then on the other end is the much more severe kids who are struggling with really any kind of interaction with other people. They tend to want to be completely by themselves. They oftentimes are nonverbal, sometimes with physically aggressive behavior because whatever they're perceiving or sensing is irritating them because we just don't understand how to best communicate with them. So these are the kids that really require the most attention and the most supervision. And the ones on the milder end of the spectrum oftentimes live completely regular, normal lives, what we would call normal these days in society and function well in society with really very minimal support. So that's why I say it's a little hard to answer the question with a single explanation. It's too diverse. But I would say that's the main components are the social awkwardness or difficulties with socializing and that communication impairment that seems to typify in one form or another most kids with autism.
So if someone says, I have a child that's high functioning, autistic, does that mean that they can go through their daily lives as you or I?
Yeah, so again, it depends on exactly how high function, but the answer to that is absolutely yes. There are many people who have had the diagnosis of autism who are extraordinarily successful and lead to completely independent lives. And it really depends on the severity or the level of autism, where you are on that spectrum as to how much support you'll need. And we also know that some people, whatever this means, but some people sort of get better as they get older. The symptoms are less extreme. They're able to manage things better, and they may require less support as they get older. And on the flip side, there's some kids who, as adults, really have not made, at least from the outset that we can tell, significant changes or improvements and really require attention and care for their entire lives.
How early can a child be diagnosed as being autistic?
So if we had this discussion 10 or 15 years ago, I would have said certainly not before age 2 and probably a little bit older. But we've come to recognize that some of the features of autism can be picked up at a much earlier age. And probably the one that at least I'm the most familiar with is the question of eye contact. Even as infants and young toddlers, they just, many of them, not all of them, but many of them just don't seem to make good eye contact with their parents. There's not that social interactive smile that we oftentimes see. So the answer to your question is that now we feel somewhat comfortable making the diagnosis, certainly as early as 18 months, but some people would say even as early as 12 months.
Okay. Now, with being autistic, how is that? Is it treated through therapy, medication? What does a parent do once they find out that their child is autistic?
Well, the first thing I want to say, and I want to emphasize to people that are listening out there and to families, is that it's a very, very triggering word to say a child has autism, and it can cause tremendous harm and fear amongst families when they are told their child is autistic. So you have to be really, really careful and thoughtful about how you use that word. And the child that they saw before the diagnosis was made and the child that they have after the diagnosis was made is no different, and they should not treat them in any other way than they ever did in terms of loving them and caring for them. But the label helps in some ways because it does help us to get to your question, which is what are the therapies that are the most effective? Medications are not effective for the autism condition or diagnosis itself, but sometimes some of the behaviors associated with it do benefit from medication, and that's usually reserved for the kids who are really so affected that they just aren't able to function in a comfortable way without the help of reducing maybe the levels of anxiety, so anxiolytics. There's a relatively high percentage of kids with autism who also have ADHD, but very easy to confuse the two. They may not have ADHD, but they might. And there are certainly benefits to getting more rest and more sleep, so sometimes providing things like melatonin to help with their sleeping routines. So there are medications not to treat there's no cure for autism, not to treat the autism, but to treat some of the symptoms that are associated with the condition. The main approach for the autism itself at this point, and that may be different, 2 decades down the road from now, but is really the therapy which we try to provide access to. That's a challenge because, as I think you're very aware, the frequency of the diagnosis of autism has skyrocketed, which means that the resources needed has amplified beyond what we're able to offer. So it's very difficult for all these kids who we give this diagnosis to get the therapy which we think is the best. The kind of what we would call the gold standard, and it's a little controversial now, but the gold standard is still what we call ABA therapy, which is applied behavioral analysis, which is a kind of therapy that works on reinforcing positive behaviors and trying to discourage some of the negative behaviors. I don't fully understand it because I've never been in a session with the therapists that do it, but it does seem to be one that helps more autistic children than not, and seems to be superior to others. So our goal is always to, once a diagnosis is made, to try to get those additional supports for these kids, which can include ABA therapy. But at its basic level, autism requires more attention. And so even if they aren't getting ABA therapy, just getting support in speech therapy and physical therapy, occupational therapy, if they have some of the physical impairments that may go along with it. But the language therapy is huge. Many kids with autism struggle with eating. They either eat way too much, they don't have the regulation kind of built into their systems, or they just don't want to eat at all. They have very rigid tastes in foods. So speech therapy for feeding issues sometimes becomes an important tool as well. But I will tell you that we're far from feeling that we have a great answer to the best way to treat many of these kids. And again, always keeping in mind that autism doesn't tell you what's causing it, just tells you what the symptoms are. So what is the best treatment? We may not know the best treatment until we further understand the different pathways that lead to those characteristics.
Why do you think there has been an increase in diagnosis with autism over the years?
Yeah, it's a great question. I mean, when I started my pediatric career back in the 1990s, we knew about autism, but it wasn't something that we saw too much. And the statistics, when you look at them, suggest that, even by the turn of the century, around the year 2000, and always take statistics with a grain of salt. It's just based on whatever information people were able to assess, but the comparative changes are pretty dramatic. But it was about 1 in 150 kids at that point, give or take, that we thought had part of what we came to call the autistic spectrum. Now we're down to about 1 in 36. So there's it's a fourfold increase in that time period. So then the question is why? And part of it really does have to do with increased awareness. We're now looking for it more. The more you look for something, the more you see it, which is important. It also can sometimes lead to misdiagnosis and overdiagnosis. But we're just more aware that it's out there, and we're more aware that it presents in many, many different ways. So that people that in the past we might have dismissed as being ADHD may in fact have autism. And we just didn't appreciate that. So it's the screening process, the increased awareness, that there are more and more eyes of healthcare providers looking at our kids to see could they maybe have it. There's certainly some suggestion. I said earlier that autism is a combination of genetic and some biologic factors and environmental factors. There may be some environmental factors that do contribute. There was an unfortunate and fallacious study that was done back in the end of the 20th century to suggest that vaccines were a cause for it. That's turned out to be simply not true. And there are so many other changes in our environment beyond just getting vaccines that maybe could have some contributory effect, but we certainly don't know at this point. So there's still an area that is being looked at very carefully. But we have to recognize that some of the social changes in lifestyle may be amplifying or bringing this out more than it was in the past. So a lot of theories, certainly no question that part of it is a screening process, but that's amplified in a greater awareness of its existence. But there may be some environmental factors that we still have not really fully appreciated that contribute.
My wonderful grandson, Cameron Nelson, is autistic. And I just noticed things. Noise doesn't bother him, but there's some other things that may bother him. And sometimes he's more emotional than other times. And it's just things that, I wouldn't think that will bother me. It actually bothers him. So with being autistic, are there things that will bother those children that we would think is just normal?
Yeah, it's a great question. And part of the description of what autism is a sensory integration problem. The difficulty in processing different sensory input in a way that's manageable and tolerable and productive for the person. And so for some of them, it is noises. They can be really bothered by just routine noises. For some of them, it may be a sense of lack of visual order, that they need to have things in a certain position for them to feel comfortable. For some of them, it is tactile sensitivities. They just can't tolerate certain kinds of foods, as an example. And so they just simply won't eat them. So it really is, in some ways, it's an assault on all of the senses that the human has, and that they simply aren't able to process as easily or as constructively as people who don't have autism are able to. There's a lot of theories about where that happened or why that happens, but they're really just theories. So I don't think we have to go into all of that right now. But they're certainly looking at what's going on in the development of the brain in those very formative first 12 to 24 months or 36 months, to see are there certain connections in the brain that just aren't being made the way that they typically occur for other people. And I think we have to be really careful, again, when we talk about autism, to not simply see it as a descriptive diagnosis of weakness or problems. As we were saying earlier, many kids with autism, on the milder end of it, for certain, have extraordinary strengths too. So although we may call them, neuroatypical, they can be highly functioning. So
Right.
the problem with the term is that it encompasses so many different types of children, and then as they get older, of course, adults. Autism, if they have that diagnosis correctly, doesn't disappear. It may become more manageable, and certainly their skills may grow, and their ability to adapt and to adjust and to function independently can absolutely improve. But it's not something that simply fully disappears from your being.
And I understand, all of that. You don't want to say, my child is autistic and have them treated any other way. I'm saying, as this concerned grandmom, I see things that, and I'm like, okay, that's because my grandson is autistic, he reacted that way. You know what I mean? Not to make him weak in any way, but it helps me to fully understand what made. I'm trying not to use the word trigger, because we don't use that word anymore. But I don't want to trigger him in any way. You understand what I'm saying? But I still want to empower him. But I'm also understanding and sympathetic to him being autistic, and I don't want to set him off in any way.
Right. If I gave you that impression, then I think I misspoke, because you absolutely do need to. But you're absolutely right. You do need, when you have a child who is on the autism spectrum, you do need to modify things that you do to make their lives more manageable and more functional. And that certainly includes trying to identify and avoid the triggers that, or factors, environmental factors that get them more agitated and upset. And you don't really know, for everybody what it is, but as you pointed out, it's different for different people. And for your grandson, it's going to be different than for another child who is struggling with autism. So being aware of and sensitive to those factors and trying to minimize those, absolutely important. I will tell you one change that has occurred in the last, 10 or 15 years. We used to try to get kids with autism to stop what we call those stereotypical movements. Some of them will kind of move their fingers around or make unusual repetitive motions. And we tried to normalize them. We tried to suppress that. And we've really come to appreciate that was about as wrong as you could be in the approach, because that's how they're calming themselves. And so what we're basically telling them is, you can't do the thing which helps to calm you.
Right.
So we need to try to help make their environments more manageable for them. But we also need to be aware of how they cope, their coping factors, and to allow them to have the space to do some of that coping. It may make us feel a little uncomfortable, but we're not the person who's going through it. They're the ones.
That's right.
And that's right. Parents. I would also say the other thing that you pointed out, because I was saying how I think damaging labeling can be. Labeling can also be very comforting, because once you, and I tell this to parents all the time, your child is no different, but by having the diagnosis of autism, we now can get access to different services that you couldn't get otherwise. And I've seen in some parents being horrified by that diagnosis, and I've seen others that are just relieved, because all of a sudden it explains to them why they just haven't been able to connect, because they've been feeling like inadequate parents. So in some ways, in some instances, it's really a form of comfort to be able to give a label, but we just want to make sure that that diagnosis doesn't become a restricting diagnosis, because there's so much potential for each of these kids.
And you touched on something as far as like they do things with their hands, and my grandson does. And I remember an incident where we were actually in church, and someone made a comment to me about my grandson. His parents were right there, and there was the comment of like, what's wrong with your grandson? Is he special? And laughed. That hurt my heart. You know what I mean? It was just like, people don't know what to say out of their mouths sometimes. and it hurts, and it can hurt, your parent, their parent. It can hurt the grandparent, like it did me. But I agree, we have to let them be them. Society has damaged us in so many ways that if you don't look normal, you know what I mean, and you don't act a certain way, you're not normal, and people usually talk about you. But thank you
Absolutely.
for pointing that out. We have to allow them to be them and not judge them and not talk about them. Thank you so much for joining me today. I want to say to all of those parents or guardians, if your child has been diagnosed as being autistic, know they are special and know they are unique. Continue to love on them as much as you can and treat them normal because they are, and allow them to be them. Cameron Nelson, I love you. Continue to be you. Peace and love.